Again, good afternoon, everyone. Thank you so much for joining our monthly webinar. We are so grateful for those of you that take the time out of your busy days to come and join and listen to what's going on in the 340B program. And I would just ask that if you could hold your questions until the end, if you don't mind. But again, I just want to say thank you for joining. We are doing a series on the 340B rebate model. The 340B rebate model is sort of the biggest change to 340B that we are going to experience in this market. And I think we're just at a time where everyone is there's a high level of fear and anxiety and entities wanting to know, what do I do? How can I be prepared? How can I recover the rebates, and who can help me do that? So what I want to do today, the webinar in August that we had where we broke down the pilot program, was sort of like a high level overview. What I want to do today is I want to give you more of a breakdown into how do you turn that policy into actual practice for your program. Let me also say we have a significant number of registrations. Some of you might be directed, if you didn't get in early enough, to our YouTube live stream where we're live streaming this webinar as well. We will be recording this. We will share the recording. We will share the slides. So let me say that as well before I go ahead and get started. All right. So I see there's some hands raised. I'm not going to unmute you at this time. If you can put your questions in the chat, that will be really, really, really helpful. All right. Let me introduce myself to those of you that have not that are coming for the first time. My name is Anthony Velasquez. I'm the Chief Product Officer here at PharmaForce. We are a pharmacy solutions provider that provides 340B technology, PBM technology, and pharmacy management systems into the 340B space and the healthcare system at large. So I'm the chief product officer here. I oversee all of the technology that we develop that allows us to provide those services. Have been in the 340B space for almost a decade and a half now, working for providers, and then spending the last 8 years at PharmaForce on the third-party administration side. I want to say one more time, I'm really, really grateful for all of you that signed up for this session. This session has broken records. This has been the most registered to session that we have had. And like I said, we are streaming this as well in other platforms. So those of you that are making it early, you're good. You won't have any problems. After a certain amount of time, after a certain number of attendees, some attendees will be directed to our other live stream platform. All right, so let's go ahead into the meat and potatoes so that we can get to the topic of today. So let me start with a disclosure of everything that I'm going to share. Everything in this space is moving really, really fast. There is a lot of information being shared from all different sources and all different angles. This is a very complex topic. So let me go ahead and say that the information in this presentation is including any analysis or opinions, represent only the personal views of the presenter. These perspectives do not necessarily align with the official stance of PharmaForce or its affiliates. This content is intended for informational purposes only and should not be considered legal, financial, or professional advice. Neither the presenter nor PharmaForce provides legal representation. Viewers should seek guidance from their own legal advisors before making any decisions on this information. So I want to get that out the way. It's very, very important as we talk about this topic. Let me also say, I don't have all the answers. I don't think anyone does. There are some things about this rebate model that we are still waiting on HRSA to provide more clarity on. So I don't have all the answers to everything, but what I do have is the ability to present to you the current state of what we know in a way that helps you grasp and understand exactly where you are as a covered entity, as this is geared towards covered entities. and pharmacies as well. I'm not even touching the pharmacy side of this because there's a big impact on the pharmacy side. I'm staying on the impact to the covered entity. So I don't have all the answers. We're in this together. I think this is going to take time to really get to the point where, all of those minutia points are clarified in some instances. So we will get there. So I'm going to start the agenda with just a quick debrief on what's the latest on the 340B pilot model. I'm going to break down the HRSA FAQ. Those of you that were with us last month know that when I did the presentation, the HRSA FAQ had just come out like a day or two before, a couple of days before, and I had already put together my entire presentation. So there were questions that were coming out, that you guys were asking during the Q&A that were answered in the FAQ that I had not used to prepare my presentation. I want to talk about the tech vendor platform. I think that's something very important for entities to know because there's a lot of questions about, are there multiple platforms? Would there be multiple platforms? Is there one? And I'll share with you what we know so far. I want to continue to talk about building an organizational playbook. You need to be ready and you need to be proactive in how you're going to handle this in your organization. And then number five, I'm going to take some of the policy, some of the questions on the FAQs, some of the stuff on the pilot model, and turn that into real practice for you so that you can know exactly what steps you can take to proceed forward. So what is the latest on this? So let's just get to where we are today. This is quickly evolving. I think we're going to turn this into a series at least until the end of the year, because what's going to happen is, the pilot was announced on July the 31st. One of the biggest complaints about the pilot is that it did ask for comments, for public comments, but it only allowed for like a 30-day period for those public comments. So it's a very short time frame for entities to be able to really grasp everything, and providers at large and others and other players in the market to really grasp what this means. This is a very, very big change in the 340B world. So there's certainly concerns about the timing, but this is moving very, very fast. So July 31st, the announcement was made public of the pilot. The HRSA FAQ was a few weeks after that released. The comment period due date was September 8th, so the comments closed. There are over 1,200, I think it's 1,243 comments that were submitted to be exact, and we'll look at that a little bit today. The most recent timeline was September the 15th, where the manufacturer plans were due to be submitted. So, as of 2 days ago, all of those manufacturer plans were due to be submitted. That I know of, I have not seen any information on that come out just yet of how many plans were submitted and all of that. HRSA has stated that they will approve those plans on October the 15th. So our next critical deadline is October the 15th, where HRSA should approve and publish those manufacturer plans that will give us basically the rest of the insight and revelation into what entities are really dealing with here with this rebate model. So the pilot was sort of you could think of it as a sandbox or a structure, and then the manufacturer individual plans all could look a little bit different, is what we are hearing. So what does this mean? Well, let me tell you what the sort of the headline news is. There are 1,200 plus public comments submitted, as I shared. I'll give you a little breakdown on that in a minute. There was a letter from 163 lawmakers that were sent to Secretary Kennedy at HHS on September 8th, asking HRSA and the Health and Human Services to abandon the pilot, to not move forward with this pilot, with concern that this pilot is not in the best interest of 340B providers and creates immense burdens for providers and many advocacy groups and organizations have been critical of the 30-day comment window that is way too short, does not allow for enough time for entities to respond in a thoughtful manner. There's questions raised about the legal authority of HRSA. We know that that is true because HRSA had just gotten out of a lawsuit with manufacturers over its authority to allow or to deny pilot models that had been submitted last year, or sorry, that had been announced last year by some manufacturers. There are providers and hospital groups. I'm just calling out the hospital groups for the sake of this presentation that have shared concerns that they oppose the rebate. There was an analysis done. I believe this was reported in the Healthcare Finance, and I believe the source was the American Hospital Association, that the average this hospital is expected to, if the 340B program goes this route, not just for the pilot, not just for those drugs, but if this is an indication where the 340B program could go, that could cost an additional $72.2 million for the average dish covered entity in additional drug spend from having to upfront the 340B, the purchasing of the 340B drugs. There have been requests for manufacturers to cover the administrative burden of managing this new sort of program here. So there is a lot of worries, a lot of concerns, and a lot of things that entities are expressing concerns about. Now, the other thing to note here is there are even publications that are stating for the FTC to get involved and to look into drug makers. There's claims that the model undermines the original intent of 340B, and I can't stress enough, this is going to be a very big change for covered entities, and covered entities should be ready for that. So anyone that's saying this is not going to be a big change is not being completely transparent. This absolutely is. So now let's break down the FAQ. Again, many of you reminded me on the last Q&A session last month that the FAQ have been published. There were questions about, well, what does it say about, mixed use, the mixed use side of drugs? There were some rumors of, we don't really, that's going to include some mixed use drugs. No, it's only retail and those drugs that are billed to the Part D plans, and we got some clarity on that. So let's go through the quick highlights. So the big news on that was, and this is, by the way, this is posted, this is live. You can just go to Google and type 340B Rebate Model Pilot Program HRSA. It will take you right to the link. It's there. You can read it for yourself and what HRSA has published. The big news was that physician or clinic administered drugs are also included as part of the pilot. So if any of those 10 drugs you use in a clinic administered setting, type thing, that has to be accounted for in the rebate. I know many of you are going to have questions exactly how to do that. The answer is we don't know yet, because HRSA has not addressed exactly what the data specs will look like for those drugs, those items. And I have a slide, I think the next slide, when I'm talking about the vendor platform, where that was also admitted in a recent webinar from one of the technology vendors that we know is going to be administering this. So this was an interesting thing that was in the FAQ, was that there will be a feedback process that will be implemented that will shape the future of the rebate model. So basically, HRSA is going to implement a process by which you, as a covered entity, can then submit feedback on how this is going. I don't know that there's any restriction on how much feedback you can provide, but would encourage you all to be thinking about a process by which you are submitting feedback to HRSA on a regular basis, using that mechanism on how this pilot program is going or functioning post January 2026, when everything is set to go live. Already, I saw a hospital group that said, "Hey, this is going to be a complete and utter failure." So if you experience that and you experience delays in payments and things like that, have a process, report that. I think that that's important. I don't think that entities should take that process lightly if they are given a voice to share those concerns. Another interesting thing is, this is another really big question that has not been answered, that's still outstanding, is that it said HRSA may consider allowing manufacturers to collect additional data elements. So if you read the original pilot, it had a certain set of data elements in there: prescription number, fill number, and things like that, things of that sort, where sort of that was the framework. But there's these little drops of information in the actual pilot model, Federal Register notice, even in this FAQ, that HRSA may, it's almost seemed like, the market is being prepped for, hey, there may be more stuff that you're actually be collected. One of the ones that we're hearing about is invoice data. It's will the data specs from what we know today as we sit here in this webinar be expanded to other data specs like invoice data attached to those claims, which again creates an immense level of complexity. A quick example just to give you is if you dispense a 340B approved claim and that claim does not reach a package size and you don't have invoicing information to tie that to, what does that mean in this process would be one example that comes to mind. The list of drugs is published in the FAQ, not at the NDC level. So if you go there, I believe it's question number 5 or 6, and you will see the list of products there. I do think that in the actual manufacturer plans, they will supply the individual NDCs that this will apply to. So I think that that's where that information will be published, and we will see when that happens. They confirmed that 340B pricing will be available on all other drugs, which I think we knew that, but I think now we have, more verification of that. One of the most concerning things about this FAQ, one of the most concerning things about this FAQ is that they said there's a limited initial list of these, 10 drugs that are part of the Medicare negotiation with a potential expansion. So the actual language, this is copied directly from the FAQ, is that the OPA, Office of Pharmacy Affairs, may consider expanding the rebate pilot to other drugs purchased under the 340B program that have not been selected for negotiation. So that is part of the concern for many providers and many covered entities, is that this opens the door for the puck to continue to move closer and closer for more and more drugs to be turned into this rebate pilot program that will have significant implications for covered entities. The FAQ also says that CEs, covered entities, should work with manufacturers to resolve payment issues. I believe that this is going to be one of the biggest pain points. There is not outside of the third-party administrator, model, there is not any other situation or workflow in 340B where you are collecting payments from a third-party vendor and then have to do your own reconciliation as a covered entity. That it's an immense burden on a covered entity to now have to set up bank accounts or get money directed at them from this third-party vendor, and then have to reconcile that that payment is accurate and correct. So there's a mechanism. They encourage you to work with the manufacturers, but there also seems to be a mechanism for escalation if that doesn't work out. So here are some of the few key takeaways that I think are really important just to highlight to save you the time from reading it, though I encourage you to go and read the FAQ yourself if this is something that's going to be impactful to you. But manufacturer plans may be limited to certain CE type. That was also something very interesting that I saw, that some manufacturers may exclude certain CE types from this. So I don't know if that's going to look similar to the manufacturer restrictions where some health centers were, Ryan White's, and some other grantee CE types were excluded. Maybe it looks like that. Manufacturers, the FAQ also said the manufacturers may submit plans after September the 15th. So if a manufacturer missed the deadline, they might still submit a plan and then it will be implemented at a later date. I mentioned already the physician or clinic administered drugs will be included, and then the escalation process when rebates are not received. So that is a full breakdown on that FAQ that you just got. I encourage you to read it, be aware, and be able to inform your team on that. Now, something really interesting was as I mentioned earlier, the Federal Registry recorded 1,243 comments all across the spectrum. I use an AI tool for this, all right? But the analysis was that 70% of the comments express opposition and concern about the pilot model, which that would align with I think what we know. I don't know of any provider, group or entity that is thrilled, supportive, or thinks this is a good idea, good for the provider, the patients, the 340B program itself. About 20% requested a timeline extensions with more clarity. I think that's a fair question that there will be more clarity on this and a longer timeline to be able to implement. It is a very, very short timeline. I'm thinking from a technology perspective, they're implementing the interface and all the technologies for some vendors in the market. That can take a very, very long time to do that. So dealing with all that will be complex and burdensome. And then some are supportive, and I think you could put, the manufacturers and pharma into that 10% bucket of being supportive of this. So here are some of those sort of key themes in some of those comments where, you know, like we would expect those of us that are and I know there may be some manufacturers on this webinar, but like we expected, the manufacturers are supportive of this. They see this as a fix to duplicate discount and some other things, and they feel at least the word is that they are ready to support this, and they have a technology platform and all of that, which I have concerns about being single-threaded, where all entities are depending on one technology vendor to do this. There are comments that we support HRSA's effort to modernize 340B. We need firm guidance on rebate timelines, et cetera. And obviously that will be in opposition with what clinicians and some individuals. There's patient access concerns. One of the other really big things, as I said from the beginning, I don't have all the answers on this, and I'm not going to pretend like I do. But one of the things is what happens to cash cards, the cash card program, where entities are providing discounted drugs at the point of sale to covered entities, is going to need to look a little bit different now because the 340B pricing is no longer provided on the 340B account. So there's patient access concerns here. There's calls for clearer definition of eligible drugs and rebates. The comments of this could harm vulnerable patients, and that's true. That's not some sort of theory. This at this moment has the opportunity to really disrupt the care of certain patients that are on those medications, because the 340B pricing is completely gone from those accounts. So there's going to be, I think, we're going to figure out ways to, try to support this, but there is problems here, and especially around patient access and things like that. Hospitals and safety net providers are, opposed to the upfront payments. It's going to create a world of, significant upfront spend with the hope that a rebate comes through and that payment, there's a burden of new IT reconciliation. Like I said, there's a fear of reduced resources for patient care, that entities are going to have to push more, resources to this process, jeopardizes low income patient services. One of the comments, manufacturers must absorb. That's a thing that I'm hearing. Is providers are asking for manufacturers to absorb the cost, the administrative cost, not just the IT platform cost. The IT platform cost is already embedded in the pilot. Advocacy groups question HRSA's authority for this, push for transparency, et cetera. And I think you get the point of what I'm trying to say. So let's move on. Here's some interesting quote. I'll just read one or two of these. You're going to get the slides and you could read more. The Association of American Medical Colleges says the administrative burden of the pilot program will also be overwhelming, as it will require covered entities to collect and submit data through a new manufacturer-specific platform, which will require new investments in IT infrastructure, staff, and technology. That is correct. 340B Health shifting to rebates for all 340B drugs will force each disproportionate share hospital to front an average of more than 72 million to drug manufacturers while waiting for rebates, straining their ability to deliver critical care services. A change of this magnitude requires careful consideration by all stakeholders. With the fundamental changes a rebate program will impose on all 340B stakeholders, it is impossible for the agency to meaningfully consider. In just 7 days, all the feedback will surely receive. So yeah, so there's a ton of comments like that. I think one of the one of the interesting one that I saw was the AHA General Counsel and Secretary said we are confident that what it calls a test will ultimately fail. So this is yet to be seen because this is new. So we will see what happens, but there is some very, very, very strong opposition to this entire pilot model from providers, which I think it's merited because it is a very big change to the 340B program. Now, let's talk about the technology vendor platform because that is one thing that I'm not sure that everyone is aware of what that's all about. But here's the scoop of what we know. I've recently joined a webinar with Beacon, which is a company that is part of the same parent company as 340B ESP. This is, as far as I can tell, this is expected to serve as the main platform to handle this. I don't have any indications that there's another platform that will be, established or set up. I think some people in the industry thought maybe there will be a couple of options, but it looks like there's going to be one for now that has come up. I don't know if the manufacturer plan approvals will change that, but this is the company that is sort of upfront about providing the connection and the data and the rebate checks on the claims. They're going to be hosting CE webinars. So if you're a covered entity, they're going to be hosting many webinars is what we heard in a webinar that we joined for us that are on the vendor side, the TPA side. So be on the lookout for that. You want to join that. You want to understand that. That is very, 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 very important for all of you that are managing 340B programs to understand that process and how that works. So encourage you to do that. Here's some other things that we learned. So Beacon assisted manufacturers with plan submissions, or at least the technical portions of plan submissions is what they said. CE registration is required, so you have to sign up with Beacon the same way that you are familiar with 340B ESP. So it's sort of, the 340B ESP is sort of a mirrored process, but now you have another place. TPA may be linked as partners to help you in submitting the data, but the bank accounts must be owned by the covered entities is another interesting thing that was mentioned, that there is going to have to be a exchange of bank data so that the rebates can be deposited and given to you as a covered entity. Purchases a non-340B price must precede claimed date of service. This is a really interesting comment that was made, that there must be a purchase prior to the claim that's being submitted, which in a sort of, the inventory model that most contract pharmacies operate under, there might be instances where that may not be the case. If you're a brand new, for example, contract pharmacy, and you're submitting claims to 340B ESP, you might not have had a purchase in the past to substantiate that. So I'll be interesting to see. Those are all some little questions that we're interested in seeing how that plays out. The CE will have full visibility into the claims and all that status and all of that. Duplicate discount checks will happen against the maximum fair price payment. Claims reimbursed regardless of package size threshold. So this the threshold. So this is interesting. At least on the webinar, we were assured that the rebate will be approved for a prescription, even if it had not reached a full package size. All right. That is what was said on the webinar by the folks at Beacon. They've been very pleasant to work with, by the way. So that's interesting. We'll have to see how that works because if there's no purchase, or if the purchase takes a long time, I'm not 100% sure how that works, and those are things that we're still going to try to figure out. Another thing that came out of this is that manufacturers have requested additional data fields. We're not going to know until October the 15th. So October the 15th, when HRSA comes out and approves the plan, then we will know, will HRSA allow the manufacturers to request additional data elements that expand on the list in the pilot model. Okay. So that is something else that that needs to be figured out. Another thing that was interesting is they did acknowledge the need or that mixed use would also be part of the rebate process, but let me just make sure I'm not muted. They did acknowledge, Leah, I'm not muted, right? Okay, yeah, I'm fine.
Yes, I can hear you.
All right, sorry about that. So they did acknowledge that they are waiting on mixed use specs from HRSA and on the approval of additional data fields. So that is pending currently. All right, so moving on here to the next, oops. Yeah, all right, so moving on to how to build your playbook. So I shared this slide last month. I added a couple of things to it because I want to bring up a couple more things, but I think that I think there's really important stuff here for you to know as a covered entity. If you just want to know, like, all right, what should I remember, from this webinar? What's important? And what's important is for you to be prepared. How can you be prepared? There are things that are out of your control as a covered entity. In other words, we're still waiting on more clarity from HRSA, you know, your TPA's ability to have all the features in place that you need in order to properly capture the claim and all that. It's out of your control, and you got to figure that out. Your pharmacy's desire to include these claims is out of your control. You got to figure that out, right? So there are things that are out of your control, but here are some things that you can do. Here's some things that give you sort of a framework of, number one, know your impact, review your impact. How much does this rebate, pilot impact your 340B program? In other words, what I mean by that is, and as I said last month, are you in a state where you're already blocked from accessing these drugs, or these manufacturers have manufacturer restrictions in your state? And if that's the case, then the impact might not be as big for you, a financial impact, or an impact to your patients from a cash card perspective. But if you are in a state where you have access to these drugs are part of your 340B program, these drugs are expanded across all your contract pharmacies, your impact might be greater. Point number two, your TPA and your TPA's ability to support is something that keeps coming up. It keeps coming up. We're hearing it, I'm hearing it. So start those conversations about what your TPA is going to do to support you. There are going to be some features that your TPA is going to need to have in place. We got an exclusive webinar that's going to be coming soon for PharmaForce entities, and I have more information on that in a little bit, where we're going to share exactly what our secret sauce is on what features we're going to release to help address concerns, to capturing claims, to not having unnecessary WAC expenditure and things like that. You need to coordinate with your contract pharmacy. Just make sure you're on the same page. Your gateways, your contract pharmacy, just to make sure you're on the same page about what process, what are they going to do, how are they going to handle this? Do they have a process in place, or what is their thinking on this? Which I think is important. If you're dependent on a specialty pharmacy, one of the big specialty pharmacies in the market, you want to have conversations with their staff and their team to see what they're doing to address this. This is really interesting. As I've been talking to clients and I've been talking to other experts in the field, I'm thinking, and I shared this last time, that you're gonna need a lead person. And I want to say that, and I don't want to pretend like every covered entity on this call has the resources for that. So I'm not saying that I don't want to say in a flippant way, but this is going to require for many covered entities at least, a 0.25, half an FTE, and in some cases a full FTE, just to handle the rebates. And if you have in-house pharmacies, to handle that you're getting paid the maximum fair price. I believe there's going to be a new role in the market. There's going to be a new role in the 340B market around 340B rebate specialists. I'm gonna predict that now, that that's going to be a thing, because this is going to be so disruptive for covered entities. And if there's covered entities where the impact of losing these savings is going to mean hundreds of thousands, millions of dollars, they have no option but to hire additional resources. And that's why some entities are saying manufacturers should pay for this because of that. Again, as things become more clear, have SOPs documented about how you see your process working. You might not be ready for all of it right now because there's some things that are still outstanding, but you can start thinking that way to start, documenting exactly what you're going to do at all of your, covered entities. And educate your teams. Educate your teams on your contract pharmacy team, your compliance team, your legal team on what this new rebate world is going to look like and what you're going to need. I remember working at a covered entity, very large covered entity, where you have to make your case before your CFO and the VP of pharmacy and others about the need for additional resources to do that. So. All right, so let's move on. We are getting to the end. All right, so turning policy into practice. What I was trying to do here is to say, hey, we have this pilot letter and we have this FAQ right now. The third sort of piece of information that you need is the approved plan from the manufacturer. So I'm going to try to give you sort of a closer look into what your practice will look like in January of 2026 as this becomes more clear. All right. So first thing you got to do is you got to set up and configure your entire rebate program, right? So what does that mean? So you can't do anything unless you're working and register with the vendor, with the IT vendor. So once you know the participating manufacturers, once the approval is published, you're monitoring the HRSA, the OPA website, your emails if you're an authorizing official, and things like that. There's going to be tons of webinars from different companies. We're going to continue to talk about this. You want to register with with the IT vendor and join their educational webinars. As of right now, that is Beacon. And you can go and find them online, but you want to know, you want to be plugged in, you want to get, the emails and all of that stuff from them. And then you're setting up banking and ACH with the vendor. Okay. So that is sort of like the genesis of what you need to do to be ready for January 2026 in order to be ready to submit claims and get paid and that sort of stuff. Okay. Now, once you do that, then you get into the nitty-gritties of the claims. So the dispensations and the claims reporting, the covered entity is going to be your responsibility to compile those claims daily for submitting to the IT vendor platform. There's going to be TPAs that will play a role in that. I know that we pharmaphores are going to play a role in helping our entities with that. There's going to be new features that TPA are going to have to release to address winners only programs. When you have situations where you might have a winners only pharmacy services agreement, but the WAC price is now loaded for these drugs on your 340B account, they will all get kicked out as not being profitable. So, your TPA needs to have features in place to handle that, features in place about, ordering so that you're not ordering unnecessarily at WAC and things like that. Consideration for your clinic and physician administered drugs, if that applies to your covered entity. So you got the setup, then you got the claims compiling. So how are you going to compile the claims from different sources? If you have, most of you have, multiple TPAs because some pharmacies require you to use their TPA. So that will be the claims reporting. Then you got the ordering. Again, the WAC pricing is going to be loaded in your CE catalogs. You want to monitor your WAC spend. You want to be careful that this does not just get ordered at WAC pricing and then you start getting a bunch of denials and then you have unnecessary purchases and big losses on those drugs as well. So you want to be careful with that on your dispensation and your ordering. Those are kind of like the two buckets you have to monitor very, very closely. The third bucket that you have to monitor closely is the payments. So set up a process for receiving the rebate payments. There's going to be a process during the registration in the ACH vendor that you're going to have the penny testing. You're going to have, there's going to be some work. There's going to be some work involved, for this to sort of happen. Some entities, unfortunately, this is going to be, task number 97 on the list of a, pharmacy director or a 340B program manager that doesn't have a lot of resources to deal with this. But some will have the option to get their TPA to help, maybe get your consultant to help, and things like that. But the payment and reconciliation process is very, very important. And what do I mean by that? So let me go to the next slide to tell you a little bit more what I mean by that. So um, you need to monitor closely that you're getting paid in the 10-day window. The reason why that's important is I've worked in large organizations that is very difficult to do. It is very difficult when you have really large accounting, finance, accounts receivables team to get access to that data of what was deposited in the bank account. It may even be in your best interest to set up a separate bank account just for this. And I know some entities are going to do that. But it is very important that if you don't get paid for the claims that you submitted within 10 days, that you have a process to report to HRSA that you are not getting paid in a timely manner. Okay. And I really would encourage entities to take that serious, to monitor that, to track that. I know that's easier said than done, but the pilot requires that they pay you, the covered entity, in 10 days. So that is important, to resolve that. The encouragement from the FAQ is that they encourage covered entities to resolve that with the manufacturers. And then if you're not able to resolve that with the manufacturer, then you can go to HRSA. So let me clarify that. The FAQ encourages the covered entities to work with the manufacturers to resolve those payment issues, any payment issues that exist. And if not, there is a process to escalate that. So I'm not saying go to HRSA for everything. I'm just saying that that's important to track. Handling of denials too. You know, the crazy thing about this program or this pilot is that they're asking you to submit all claims, cash claims, private claims, Medicare claims, Medicaid, MCO claims, if you're in a state that allows that. So you're submitting claims that are for all payers, including your cash cards, that have nothing to do with Medicare, and then you're sort of hopeful that that gets paid. And if you have a lot of rejections and denials for whatever reason, or something wrong in the data or some other issue, that's going to cause for you to have high wax spend without the rebate. And it's going to be a big problem. So you want to monitor your denials or your rebate rejections at the claim level. And you want to look at that on a regular basis. And I know I'm sounding like I'm just throwing more work on you as a covered entity, but that is the fact of, that is the way to do this right, is that it requires a lot of reconciliation, making sure you're getting paid, making sure you're not getting denied on claims that you shouldn't be denied, etc. And those of you that are submitting to ESP have shared with me you're spending 15 to 20 hours a week just resolving issues with losing pricing, etc. And I kind of see that this going the same direction. So sorry to not, I don't, I wish I had really, really great news, and some of the great news will be around that we as a third party administrator are understand this and are ready to support our customers and our entities. But in general, this is going to be difficult for most covered entities. So, all right. Lastly, submit feedback. Have a process that quarterly, monthly, you're going to submit feedback to HRSA on the process, and how the process is going for your covered entity. Because I think it sounds like that is important to HRSA. All right. This is announcement. This is exclusive PharmaForce client. I know I looked at the list. There's a lot of you on this webinar. So there will be an exclusive webinar for all PharmaForce clients where I'm going to go into a deep dive over our Claims Connect platform and how the interfaces that we're going to do to support the rebate model, to submit claims, to reconcile the payments. And I'm going to do a preview deep dive. I'm going to talk about the new features that we're going to be rolling out prior to the end of the year, to support this. So we will be ready, and that obviously I can't share all of that on a webinar like this, in front of hundreds and hundreds of people. So if you're a PharmaForce client, there will be an email coming out to invite you to an exclusive webinar just for PharmaForce covered entities to know exactly what we are going to do. And I'm going to share our entire playbook with you of what we're doing to support you. If you're interested in finding out more and you're not a PharmaForce client, you can contact us at the info@thepharmaforce.com, and one of our sales team members would speak to you and walk through that with you. All right, so I think that's it. So what do I got? Okay, it's 2:46. I think that's it. I don't have anything. I usually try to keep this around 30, 35 minutes because I just want to make sure that I don't take too much of your time. I really hope that you found this to be useful. I'm going to take some questions now, but here's a few conferences. Here's a way you can contact us, follow us, etc. We're going to change this session into a Q&A session. So let me go and thank you for that comment. I just saw that comment. It's a really nice comment. Thank you so much. All right. Thank you, Jonathan. I don't know what you guys can see at this point. So let me stop sharing and then let me stop sharing and let me reshare this. Okay. Okay. So let me go through some of the chats. I think participants can all see. Okay. Let me go through some of the chats. Yeah, thank you. Yep, thank you. Thank you, Jonathan. Thank you, Christina. Thank you for the encouragement. Okay. Any questions? Hey, if any of you want to come off of, again, I don't have all the answers, but if anyone wants to come off the mute button and there's no question. Oh, okay. Okay, there's some questions in the Q&A. Yes, we will record this. The slides will be available as well. So you will receive that. You will receive that. Yep. Any questions? If you guys, there are still hundreds of you still here. So if any of you want to raise your hand and come on, come live. And all right, here we go. I see hands raised. Let's see. Let's see. What do we got here? All right. Christina? Let's see. All right. I always wanted to say that. Christina, you're live on the air. Feel like a radio host. All right. Christina, you're muted if you have a question. All right, going once, going twice. All right, Christina, moving on to Carolyn. Carolyn. All right, no Carolyn. Graciela, how about you?
Hi, Anthony. How are you?
Hey, can you hear me?
Can you hear us? Okay. Hi, Anthony. Can you hear me? We are on the
Hi, yes, I can hear you.
Anthony, I have a question for you. My name is Martina. I am the chief pharmacy at Healthcare Network. The rebate, is it a voluntary program or is it something that we all have to do? If you're not registered by 10/15, are we going to not be able to participate at all, or how does it work?
Yeah, that's a really good question. That's a really good question. I should probably start all of these with sort of that basics. Yeah, it is voluntary for the manufacturers. It's going to be fully implemented for all covered entities. In other words, in January of 2026, you will lose 340B pricing on the drugs that are approved by HRSA for a manufacturer approved plan. So the manufacturer approved plans will be released on October the 15th. And those that are approved for that plan, you will lose 340B pricing on those prescriptions or on those NDCs and those drugs. And the only way that you can recoup that loss and savings is to participate in this rebate model. So if
we have to be approved, that's what you said. We have to be approved, so we get picked by the manufacturer, or we apply for it. You remember when ESP was coming live, we had to register to participate in ESP. Is it the same concept, or
yeah. What a great question. It's the same concept. Absolutely. So You as a covered entity will now be able to go to Beacon and think of Beacon as ESP 2.0. Beacon is just another ESP that you'll be able to go into, register, set up your bank account information, and they're going to give you training on how to submit the claims, and things like that. So it will be the same concept. And then instead of you getting access to the 340B pricing, they're going to instead send a payment to your bank account. And you're going to say, hey, I'm submitting for this drug. And they're going to say, okay, we approve that. The difference between the WAC and 340B on that drug is $250. So we're going to send you a payment for $250 to your bank account that you gave us.
So with what you said, that means we get to pick which drugs we are going to be registered for. Just like on ESP, you pick which manufacturers, but this one is which drugs you want in your program.
Yeah, there's 10 drugs. There's 10
Huh?
drugs right now, and
Right.
then all the NDCs under those drugs apply. But
Mhm.
yeah, if there are going to be some drugs where the MFP is where the 340B price is higher than the MFP, so those you could probably exclude, if that
Okay.
makes sense. There
Uh-huh.
are some drugs where the 340B price is very low, and you want to include those drugs. And you
Okay.
want to get a rebate on those drugs.
Anthony, do you have a phone number we can reach you at? Is that okay if we talk to you offline?
You can use this email, the info at the PharmaForce, or you call that number
Okay.
and just ask for me and you'll get in contact with me.
I appreciate you so much. Thank you.
Yeah. Yeah, thank you for your question. That was really good. Thank you so much.
Mhm.
All right, question. I got a question from, if anyone else want to raise their hands, please do. Okay, I see Michelle. Michelle and Jose, I'm gonna call you in 2 seconds. There's a question of, have you heard of Beacon will negotiate terms of use? I have not. There was an anonymous attorney that asked that question. I have not heard that, if they will do that. When does the Beacon platform become open for registration? I don't know. I think Rose, if I'm saying that right, Rose, I don't know. What we did hear on a webinar that we were on with them last Tuesday was that outreach to covered entities was going to begin immediately, and covered entities will be invited to multiple webinars. So you should either reach out to them and go on their website, or and make sure that you're signed up to receive all of that. All right, so I'll do two more. Michelle, let me say, all right, Michelle,
Hi.
are you?
Yes. Hi, this is Michelle. I have a question for you in reference to auditing this process,
Yep.
from the standpoint of the rebate as well as auditing the TPAs.
Yep.
What would be the overall recommendation of the audit? Would you recommend 10% higher? Would you round the numbers for an audit to keep the federally qualified health center compliant with HRSA?
Yeah, Michelle, because some of the products have a really high there's three of the products are very expensive specialty medications. What I would say is you want to track every single one of them, is what I would say. I know
Okay,
that's I know that sounds crazy, but the difference is you could be talking about losing thousands of dollars on one prescription because of how expensive these products are, that if you miss it because it got kicked out by your TPA, it didn't get submitted on time, it expired because of the 45-day window, etc., the entity is losing out on a significant amount of savings.
so
So
what
I
you're
would,
saying is you're saying you should audit every single one of these 10 drugs that are part of the rebate program on top of the audits that we already do for our TPAs to comply with HRSA and 340B, which is another 10% per TPA.
yeah, let me add another layer to that. And I'm also saying you need to audit the payment. It's
Right.
not enough just to audit, that the drug was submitted to Beacon, that the drug was approved by Beacon. you want to audit that the money actually hit the bank account. And that's the part that I think is going to be very complex for covered entities to do, because you now need access to the covered entity's bank to make sure, like, hey, I got a report from Beacon saying they deposited $30,000 into our bank account. Accounting team, is that true? Do you see a payment for $30,000? Yes, we do see a payment for $30,000. Okay, great. Let me look at the breakdown of that. Did all my claims that I submitted make up that $30,000?
Okay,
That's
so this is not going to be an easy process. Is there a platform for this, or would we run this in? So I guess my recommendation is we'll run it through our EHR system like you would do a reconciliation program.
Yeah, Michelle, I can't comment on that because I don't know that process well enough. I can tell you that, like, us pharmaphores as a TPA are working on building that entire interface with Beacon to be able to make that process as seamless as possible for our covered entities. Because I do see a world where the TPA is going to have to, it can play a really key role in this, because if not, it will be so manual. Like, it will be so manual for you to download the claims, format them, load them to the Beacon platform, then get the response file, then go back to your TPA, uncapture the ones that were denied, and then wait for the payment. When the payment comes in, do the reconciliation, and you have to audit them for 340B, compliance. I mean, it's the whole process is going to be crazy. It really is. And so I think entities will need to ask more of their TPAs, because the TPAs are positioned to really be helpful here in having access to the claims, because we're processing them and we know what's eligible and what's not, etc. Submitting the claims because that process exists, and then helping with the reconciliation and providing easy reporting so that you can say, all right, $45,000 here, here's all my claims, check, 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 check. That all ties together. So yeah,
Well,
Michelle, it's I know it's a little discouraging, unfortunately. I wish I had better answers, but
well, Anthony, I want to thank you very much. I've ran a pharmacy for 40 years, so I'll figure a way to wrap it into our reconciliation. I appreciate your comments and
yeah,
appreciate the webinar very much. Thank you.
thank you, Michelle. That was really, really, really grateful for those comments. I really appreciate it. All right. Anyone else? Last opportunity. If you want to come up and chat. I've always wanted to do this. I just think this is cool. Like, just to be like, hey, you're on the air. So if anyone else wants to come up and chat, I am open. There are so many of you still on. If not, we can call it a day. All right, let's call it a day. All right, lastly, I just want to say, yes, this will be recorded. This will be publicly available. And I think we cut the Q&A just to protect everyone's identity, but this will be recorded. The slides will be provided. And I think we're going to just continue to do a series just to, you know, our next milestone is October the 15th on what manufacturer plans got approved. So I think we're just going to continue a series through the end of the year on to keep you all informed of what's going on. So that's what we'll do. You'll see more from that. All right, great. Thank you so much. Have a great day. Thank you for joining us. Again, I can't express how grateful I am for your time for joining us. Thank you. Bye.